All right. So good morning, good afternoon, colleagues. Thank you for joining this webinar. This conversation is really around the whole topic of a time of crisis, so health inequalities in the era of climate change and COVID. We have a great panel with us today who will be taking us through all those different topics, and we really have a lot to discuss this morning or afternoon for you. I'll allow the speakers to probably make an introduction when they're about to speak. So as a matter of process, that's what we will flow from that. Just to give you an overview of the purpose of this event. So the C20 Global Health Working Group has the overarching goal of achieving universal health coverage and to advocate for health as a global public good and human right, which is critical in achieving the Sustainable Development Goals. Furthermore, the G20 has identified health threats as a central objective towards economic stability and prosperity, with the G20 Health Working Group's priorities covering the need to monitor the impact of COVID-19 on the SDGs, build transformative resilience, establish collaborative responses, and ensure access to tools required to achieve UHC. So the speakers that are going to be speaking today will be covering several of those areas, and will be probably bringing that connection between the whole aspect of COVID-19, the whole issue around climate change, and probably offering us some solutions or some thoughts, some food for thought in terms of what we should be thinking about going forward. Just in terms of a point of introduction, my name is Kenneth Macharia. I'm the country representative for Options Consultancy Limited. Options is a UK-based organization, but with a global presence. We are a health systems strengthening organization working in maternal health in various countries, over 50 countries globally. So I'm currently based in Nairobi, and I'm glad to be here. So I just want to give you just a brief overview of some of the points that we're going to cover today. So as the impacts of climate change and the regularity of global health crisis increase and persist, this event will draw upon the interlinkages between these issues and the need to take an integrated approach, the G20's pillar of action: people, planet, and prosperity. As you know, it will provide information about the realities and the challenges born from the intersection of climate change, COVID-19, and the lack of UHC faced by people globally. In particular, it will highlight how inequalities are impacted and exacerbated by this crisis. This event draws upon Action for Global Health Policy, position paper on climate change and global health, which aims to highlight the linkages between climate change and health. And for me right now, it's important just to reflect on where we've been. We've had about 4.5 million deaths globally, and we have about 219 million cases of COVID-19. So these are not small figures, and they've left a mark on the global economy. We've seen job losses, we've seen economies really go through a really hard time. And so as we have this conversation, this is one of the things that we reflect upon, because it is an ongoing crisis that we're facing. And so I'm looking forward to hearing what our panelists have to say today. I'm really looking forward to that. So without much further ado, I want to introduce or welcome our first speaker for the day. And this is Nicole Redvers, Dr. Nicole Redvers. And I'll welcome Dr. Nicole Redvers to first introduce herself and then obviously speak to her topic for today. And her topic for today is focusing on health systems. So welcome, Dr. Nicole.
Hello, Anatea. Nice to be here. Good morning. I'm based here out of Canada, so it's about 6 a.m., bright and early, but happy to be here. I'm a member of the Deninuqua First Nation, Indigenous peoples from subarctic Canada. However, I'm also an assistant professor at the University of North Dakota in the School of Medicine and Health Sciences and am board chair of the Arctic Indigenous Wellness Foundation with the mandate of bridging Western systems and traditional systems as it pertains to health and wellness, but also climate change and health. The majority of my work is at the intersection of various knowledge systems, elevating voices of Indigenous peoples, but at the same time speaking to the importance of planetary health in regards to climate change, the health of our planet, the health of our people, and what impact it makes on systems. So as Kenneth noted, I'm going to be talking a bit today from a health systems perspectives. And our current systems of healthcare provision contribute to climate change. And our healthcare provisions account for about 4.4% of global greenhouse gas emissions, which include 10% of emissions from the United States alone. Now, if global healthcare were its own country, it would be the 5th largest climate polluter on the planet. And with this, although climate change increases the healthcare burden and prevents adequate healthcare provision in many contexts, current carbon-intensive models of our healthcare systems, unfortunately, continue to damage the climate. And I cannot emphasize enough that the climate crisis and the health of citizens are interlinked and have many of the same solutions, especially when it comes to strengthening health systems. Now, given our urgently changing world, we have a global responsibility to ensure climate resilient health systems, to ensure our health systems are both sustainable, but considering the healthcare sector, including its supply chain, must deliver care without contributing to climate change or environmental degradation. And these systems should bring ongoing and sustained healthcare to target populations and protect the health and well-being of our future generations. Now, sustainable climate resilient health systems offer us a chance to demonstrate leadership for other sectors. And as the world looks to health systems in response to the COVID-19 pandemic, health systems also have an opportunity to be climate leaders, contributing to a healthy planet and better health outcomes for all. So, how can we consider delivering sustainable and climate resilient health systems? And the Health and Climate Network has helped to answer this important question by developing a helpful brief to outline what actions national governments should or could take. And the first action is to build the capacity and the resilience of health workers, facilities, and systems to proactively anticipate, but also be able to respond to climate change. The second action is to develop sustainable and climate resilient health systems, which provide primary health care for all and are underpinned by a rights-based approach to public health and healthcare, which of course is a critical topic for our discussions today. And the third action is to decarbonize health systems in a health-centered way, while also providing leadership for other sectors. And then lastly, I want to highlight the action to prioritize, promote, and facilitate investments in sustainable and resilient healthcare. Now, this healthcare roadmap is not to be looked at in isolation, but instead understood as an interconnecting roadmap with other sectors and responsibility, including that of the food, transport, and energy sectors. And I also at this point cannot emphasize enough the greater responsibility of high-income countries as the main historical and per capita contributors to climate change. High-income countries must help finance this roadmap globally. Now, the health risks posed by climate change, including greater exposure to current and new diseases, which of course is demonstrable by the current COVID-19 pandemic, lack of safe drinking water, extreme weather, and higher temperatures disproportionately affect already marginalized populations and those living in low and middle income countries. Areas with weak and vulnerable health infrastructure will be least able to cope with and respond to these changing health risks. And at the same time, climate change pushes vulnerable households further into poverty, making it even harder to be able to afford care. Now, I myself am a member of the Dene First Nations, as noted previously. We are Dene Indigenous peoples located in Denede, which is in the northern or subarctic portions of Canada. And the climate impacts are already being demonstrated in my home region, which is warming at roughly twice the global rate. The subarctic region of my traditional homelands have already passed the Paris Climate Agreement, set at no more than 1.5 degrees Celsius above pre-industrial levels. We are right now, sitting back home at a 2.3 degree rise since the 1970s. And we can see the direct effects of this change already in our landscapes and in our health. My home region is populated by majority Indigenous peoples who have contributed the least to greenhouse gas emissions and other global environmental changes, yet feel the effects the most due to habitation in this region undergoing rapid change, but also a deep and fundamental connection to land and water. We have a responsibility as members of this planetary home to ensure it remains safe and viable for future generations, and health systems are no exception to this. So I hope this brief overview and discussion will help stimulate thought and your reflection as a Mother Earth ally in how your own positions may move the needle to ensure our places of healing, our health systems, do not further harm our environment and ensure sustainable, equitable care for all who need it on this beautiful planet. So thank you, Kenneth, for the opportunity to speak today, and I look forward to hearing from the other speakers. Thank you, Masicho.
Thank you so much, Dr. Nicole, for that really insightful presentation. What I'm taking away from this is that, those who contribute the least are facing the most adverse effects of climate change. But also, I think when we look at the whole crisis that we're facing around COVID, the fact that our supply chains are so interconnected, and so we've realized just how interdependent we are as a globe. And so it's important that we have some collective action for everybody to take responsibility on this very important issue that you've raised. So I'll ask the next panelist, and we'll take questions as we go along. So please drop your questions on the chat so that we can pick them up when it comes to the Q&A session. Thank you so much, Dr. Nicole. So right now I want to invite John Otieno. John Otieno will be speaking on he'll focus on nutrition, climate change, and COVID-19. And John is coming to us all the way from South Sudan. John, over to you. Welcome.
Thank you so much, Kenneth. And already Nicola set the ball rolling, discussing about how climate change has had a significant impact to different locations. And if we drift just to, take this discussion to the next level in relation to nutrition, how climate change has really impacted directly to food and nutrition security. As you have said, having this call all the way from South Sudan, and those are one of the reasons why I'm here, because we've had floods for the last 3 months in South Sudan, and the situation is really, really, really tough. We've had to evacuate homes to higher lands, and on top of COVID-19 response and managing acute malnutrition because of the existing drought that has been for a long time, if you look at the IPC classification for South Sudan, we are at a critical state, and the number of malnourished children in some of our facilities are very high. And so on top of climate, on top of the burden that we already have in terms of managing severe acute malnutrition and moderate acute malnutrition, we already even have children being admitted with waterborne diseases from areas that have been hit by the floods. And in one of the communities that we visited this week, they say they have never seen floods since, such kind of floods since 1979. And these are some of the impacts now they're seeing for the first time. And we've seen the burden in our facilities with children who are, because they don't have access to food. The floods have really cut off roads, have cut off markets, have cut off homes, waterborne diseases, because now they can't even access sanitation facilities. And you already see the drifts. Apart from us, action against hunger responding to managing acute malnutrition that is exacerbated by access to food security, we already now have an impact of flood or flooding. And that's alone, it's already an issue that has really brought all partners together, looking at how we can respond. Meaning, if our budget was directly for managing acute malnutrition, it means we have to now do an additional funding to manage the flooding crisis, for example, in South Sudan. Now, let me shift you back to Kenya. Just recently, the government declared drought a national disaster. And you could see how animals' homes are affected. People are migrating, children are dying, malnutrition cases are increasing. And it means, coupled with COVID-19, you already see a very, very big shift towards government response. So in totality, looking at Horn and East Africa, climate change has had an impact, and not just flooding alone. We have seen floods that are pushing now the desert locusts towards East Africa. And that has really ravaged our food and nutrition security aspects, where, where we didn't expect flooding has come, and we've seen locusts are now moving towards where the fields are green, and they are expanding into the countries that already had, impact in terms of food and nutrition security. So in general, some of these actions that Nicholas mentioned, bringing governments to discuss about greenhouse gas emissions, how we are ensuring that tilling of land is taken into consideration, and ensuring that communities already understand the impacts of climate change, because it is with us. Uganda didn't currently, at this time, they don't expect high rains, but we see it. We see it directly. Personally, I've seen how I invested money directly to my farm, and trust me, even one sack of maize didn't suffice. Whereas I invested close to about 15,000 Kenya shillings. That's about $150. And so that's just already an impact that we see. And if we don't act now, this is with us. And of course, malnutrition will continue, and we will continue seeing the impacts for so many years to come. So my clarion call is that we put all these concerted efforts, and that we already have a burdened healthcare system to manage malnutrition. And so climate change is already now increasing that burden. And so a clarion call is now to have technocrats, advocacy through parliament, and ensuring that some of these things that we are discussing are not just discussions in the boardroom, but they should be legislated directly, bringing out champions for climate change in nutrition, bringing in people who could speak on behalf of the communities, where we are doing dikes and we're doing using of pesticides that will already harm some of our foods. And this is, it's already a cycle, a synergistic cycle. So Kenneth, as I conclude, is just to reiterate that climate change is really affecting nutrition, or rather food and nutrition security, and the time for us to act is now. Because if I took you to the isolation center where we could manage about 2 to 3 children, right now we are managing more than 15 in a week. And the burden to the households, the length of stay for these children while being managed, the agony of the mother to stay in the facility or the stabilization center, whereas they should be taking care of other children. So those are the intricacies that climate change has really brought towards nutrition. And so I want to end it at that, and just tell, of course, to the team that this is not just for agriculture or food and nutrition security, or those who are so sensitive about climate change, but it affects everyone, including you, Kenneth, because anytime food is not available, it's climate change. Anytime children are coming to the isolation center for management, for acute malnutrition, it's exacerbated by climate change. So that is really, really something that we really need to still talk about. Thank you so much, and back to you. I hope I was very clear and that you're able to hear me very well. Thank you.
Thank you so much, John, and thank you for bringing it home. I think everyone loves food, and so that kind of brings it home for everyone. But you make a very good point. I think the issues around floods are many countries. We've seen this in Germany, for example, this year, where there were floods and it affected many homes as well. So it's happening globally, not just in sub-Saharan Africa, but in many other countries across the globe. So I think you make a very good point on that particular issue. And I think as we talk about issues around access to services and really this whole issue around inequalities, it's important to note that the starting point for the low-income countries is extremely low. And so when you add COVID to that mix, as well as climate change, the situation is unbearable, and we've seen that even for economies that are much more advanced or a lot more stable, with many more facilities, are also struggling from this whole situation of COVID-19. I mean, we've seen this in the US, we've also seen this in the UK, and we've also seen this in Italy. So I think it's a real concern that we truly all have to have some collective action towards this particular issue, and really making sure that we not only see this as somebody else's problem, but that it's right next to us, it's right at home, and that we need to make some changes to how we're doing things. So thank you so much, John. So now I'll want to introduce the next speaker. The next speaker is Rhiannon Osborne, and Rhiannon will focus on the connections between health and climate justices and the need for deeper reform. So welcome, Rhiannon.
Thank you so much. Thank you so much for having me. And yeah, thank you so much to all the other amazing speakers. I can see Mel is very kindly just getting my slides up at the moment. So I'm a medical student, researcher and activist based in the UK. And my work focuses on policy, advocacy and research related to climate justice, global health, health inequalities, and access to medicines, including COVID-19 vaccines. So I'm going to talk a little bit about how we connect what we've discussed today with deeper issues in the global economy, global health governance, and how we connect this to COVID and climate. So I think first, let's kind of look at what's going on even before we talk about the impacts of climate change. So when we look at reducing emissions, we need to think about, are emissions the only problem, or are the drivers of climate change and the drivers of global health inequalities the real kind of underlying problem? And COVID has shown us kind of very starkly the impact of local, national and global health inequalities. But it's really important to remember that the people who are most vulnerable to COVID, no one's inherently vulnerable. People are made vulnerable by a society or an economy or a justice system which doesn't care for them. But how does this relate to climate change? Well, in so many cases, the causes of health inequalities are also the causes of climate change. And I think on the screen, we can take a couple of different examples. So if we take our energy system, even if it wasn't causing climate change, our energy system is failing us dramatically, both for people and for health. For planet and for health even. The extraction of fossil fuels in places like the Niger Delta results in massive health problems, both from direct violence and militarization in those regions, but pollution and oil spills, which massively reduce life expectancy. And then when we burn fossil fuels, air pollution is one of the greatest killers and disproportionately affects existing marginalized communities. And at the same time, this energy system isn't even providing energy. Millions of people in the UK alone live in fuel poverty, and billions of people across the world lack access to electricity. So that's kind of the energy system. And then if we take the food system, the biggest cause of land grabs globally, so that kind of taking land away from original inhabitants such as indigenous people, is for agricultural production. And not only do these land grabs frequently put us at risk of increased zoonotic diseases, but the current agricultural practices globally also contribute hugely to emissions, deforestation and loss of biodiversity, and have direct impacts on the health of local communities as well. In the meantime, food systems aren't meeting our health needs, and billions of people in the world are malnourished in different ways across the world. And so many other issues, such as lack of access to affordable public transport, low quality housing, and much more, are issues for both health and climate in their root causes. And I think that's where it's really important to look when we look at system change and what we're advocating for. And if we go to the next slide, I think it's also important to look at what power structures and what dynamics and how these systems are reproduced in the way that we respond to crises like COVID, other global health crises, and the climate crisis. And what we see in response to both climate and global health crises is huge aspects of inequality and power, both between the global north and the global south countries, but also between public interest and corporate interest, which kind of reinforces rather than challenges these root causes. So if we look at how we've responded to COVID, obviously it's no secret that the distribution of COVID vaccines is hugely unequal across the world, mostly because we've left this completely up to market mechanisms, which naturally leads to rich countries being able to look towards booster vaccines, while billions of people across the world are without access to vaccination. And most COVID manufacturers have so far refused to meaningfully tech transfer. At the same time, many countries are still having to spend more money on servicing their debt to people like the IMF rather than on allowing their healthcare systems to respond. And if we compare this to so far how we're responding to climate, as other speakers have really beautifully illustrated, it's not the people who are most responsible for the climate crisis who are facing the worst impacts. But so far, our current responses are not holding rich countries or corporations who are overwhelmingly responsible for the climate crisis to account. We see a significant amount of rich countries offshoring their emissions, advocating for net zero, leaving ample space for greenwashing and false solutions such as offsetting. And there is a huge reluctance to actually stop oil companies from producing more oil. In the UK, a new oil field called Cambo is set to get imminent approval. And a lot of this is related to how much influence transnational corporations have over national and global governance structures. And we know that the climate crisis, as already highlighted, is going to impact the most vulnerable, including those without access to healthcare and those suffering from health inequalities. And if we take an example of this, the climate crisis is going to increase the number of people fleeing disasters and instability, meaning that we have more climate refugees and climate migrants, a group who already suffer immensely from health inequalities. But how are we responding to this? Well, at the moment, the UK is pushing through a new borders bill dubbed the anti-refugee bill, and we're seeing increased securitization and militarization of European and other Western borders as more people need to find a home away from the climate crisis or where the impacts are less felt than in their home countries. And so if we go to the next slide to kind of wrap up, because I don't want to kind of end on just problems, I also want to end on solutions and how we go forward. So a lot of this comes down to root causes and the principles of neoliberalism, where privatization, marketization, and trade liberalization are taken for granted as good without any consideration other than increasingly reduced regulation for the health of people and planet. Meanwhile, individualist approaches to these crises put the blame of a health crisis or the carbon emissions on individual consumption choices rather than a bigger issue in system design. But the deep relationship between global health justice and climate justice means that looking at civil society and activists to change the system is kind of where we should be looking at, because it's great for health, it's great for equality, and it's great for the planet. And that's kind of what I want to end on. And I guess, what would this look like? I mean, I'm not the one to say what it would look like. It's very much a collective thing, but we'd be looking towards things like full democracy, transparency and accountability and governance. We'd need to reform global trade rules to promote kind of progress for people and planet rather than to prevent it. We'd be looking at rolling back privatization and marketization in favor of evidence-based economic practices. We'd really recommend looking at donor economics, which designs explicitly for people and planet. We'd be prioritizing equitable access to healthcare, healthy food, housing, transport, and more. And a lot of this could come within a global Green New Deal centered around equity and justice for people and planet, which would also be a huge win for global health. So I think I'm going to end it there. Thank you so much.
Thank you so much, Rhiannon. And you almost read my mind. I was going to ask you about your solutions, and I'm going to do the same for all the speakers, because I think it's important to highlight where there are failings, but it's also important for us to reflect on what is possible. What should we be exploring as real solutions to this particular crisis? So I actually want to go back to Dr. Nicole, because she spoke about supply chains in her presentation, and I just wanted to reflect on what does that mean, for example, for where you are right now in Canada, right? And what does that actually mean? In Africa, for example, the COVAX facility has predominantly relied on the India, vaccines, and so still, the issue of moving vaccines from one location to another still contributes to the emissions that we're experiencing globally. So I want to ask the question, what does that look like, especially just bringing us back to the whole issue about health inequalities, and what has that meant for where you are? Dr. Nicole?
Thank you, Kenneth, and thanks to all the other speakers for enlightening presentations on their respective topics, which I think will bridge some excellent discussions here today. And, Kenneth, is an incredibly important question because, as Rhiannon noted, we can't just talk about the problems, we have to think about what the solutions are. In the global supply chain within healthcare specifically, and again, I'm talking specifically in the healthcare system context, is the highest percentage of emissions comparatively to all other aspects of healthcare delivery. So it's an incredibly important locus to focus efforts on in the reduction of healthcare emissions globally. And there's been, to date, a lack of receptivity in cooperation from many supply sectors within healthcare, although we are seeing improvements in this. Not only in the mechanisms of how we get raw materials, but also the production, and as of course you noted, the transportation of these goods. There's many excellent people working on this question. I turn people to Healthcare Without Harm, which is an organization that's been doing a lot of work around supply chain questions and issues in that. In considering looking at circular healthcare systems, more reusability. We used to 30 years ago reuse a lot of our materials, and then we came to now where the one-time use elements are pervasive. And we've sort of been told, and which has been amplified by the COVID-19 pandemic, the risk of infection, for example, from reusing devices. However, it's been proved time and time again that appropriate disinfectant procedures and appropriate considerations of materials that can safely be used is actually better for people and for planet as well. And it's going to take a loop to get there. I remember talking or hearing from a physician who was based out of Yale who just said, we're so used to just taking our one pack, we use it and we throw it out. We've been taught that's best for infection, but we're having to rethink this whole process now, because where I am, where you are, if we can reuse the materials that we have in safe ways, it's going to reduce our impacts overall. So there are absolutely solutions out there. It's just a matter of working with suppliers. Our health systems are huge buyers. We have huge market sway. Cooperation with hospital systems will facilitate better deals and ensure that we're pushing suppliers to consider some of these efforts as we move forward.
Thank you so much. And I think what you've just highlighted leads me to John, because in South Sudan, let's just travel to South Sudan. Given the context that he's just presented us with, the fact that there are floods for the last 3 months, it means that, for example, access is an issue. So, and we kind of take for granted that you can actually get if you have the product, you can actually get it to where it's needed. I would imagine that the scenario that John is facing in South Sudan is very different, meaning that it's not just a question of access to this, life-saving commodities in health, But there are other issues that come to play, which kind of link into the whole issue around health inequalities. It's not just a question of, do we have a facility, but can we actually get the care that we need? John, so maybe just give us a reflection on where you are right now. I know you spoke about the whole issue around isolation centers and obviously the other diseases that are still present, even in a COVID era. So maybe just give us your input on that, especially given the context that you're in right now.
Thanks, wonderful, Kenneth. And I really appreciate thoughts by Nicole and the rest of the colleagues or rather the panelists. Now, in terms of cycling back on the issues about access, definitely. Where we have our colleagues have to use boats to access some of these locations or evacuations. You have to use flights to get to the unreachable. The beneficiaries that we've been serving for many years right now are cut away from the rest of the world, and of course, including within South Sudan. So what in terms of our response and access, we have strong emergency response team. And of course, we are not working in isolation as an organization. We are working under the emergency cluster convening team. So we look at some of these overarching issues. Is it about transport? Is it about availability of commodity? How does it get to there? The whole logistics about getting services closer to the people. Then the other thing is currently as Action Against Hunger, and this week we are also still providing COVID-19 vaccination exercise, or rather supporting. And next week we are airlifting about close to 20,000 doses. And of course, much more that will be in pipeline from government. And just to support government initiatives so that we ensure that even our teams, the frontline healthcare workers that already are isolated by the impacts of climate change, that is refers to flooding, also can access COVID-19 vaccination. And then in terms of access and availability of food, trust me, the situation is dire. And in terms of call for action, we have looked at the raft of items that could be looked at. And so having a nutrition and health stakeholders, carrying out a needs assessment to look at the key climate change adaptations and mitigation initiatives. And that one, we've also looked at having an intergovernmental panel on climate change, IPCC, directly within countries, so that they look at the policies, actions, and the frameworks that have already been developed. So as to improve the multi-sectoral coordination, to ensure that the political will is clearly integrated, and that some of these commitments that are directly towards climate change, for example, the just concluded UN Food System Summit, we had countries that had made pledge or commitments towards climate change and food and nutrition security resilience approaches. And so those are the things that at country level and at the regional level we are looking at. And lastly, as I conclude, is to having placing human rights at the center of strategies to mitigate some of these things, ensuring that adaptations to impacts of climate change are clearly articulated through government linkages, meetings, having parliamentarians involved in climate change, budgeting, and directly ensuring that farmers are cushioned, such kind that when we have floods and farmers are not able to have their harvest, then how do we cushion them moving forward? How do we ensure that the food chain is not interrupted or disrupted for that matter? So that's some of those things that are at higher level and directly also involving community-related actions within the community. So that's my submission, and back to you, Kenneth. Thank you.
Thank you so much. I actually want to follow on that particular point. And as we talk about the effects of climate change and also the whole issue around adaptability of communities and how much we can support them to be more resilient, it gets me to ask a question, are we doing enough around early warning systems? And maybe just, I don't know if you have a reflection on South Sudan. And I know in other countries across Sub-Saharan Africa, this is a key issue. And once you respond, I will come to Rhiannon because she talked about the impact of climate change and those whole issue around health inequalities, but also generally just livelihoods that is forcing people to leave their homes and seek refuge elsewhere. So I think that's also something that we want to reflect on. So over to you, John, again.
Thank you, Kenneth. Brilliant question. So just to reflect on issues about mitigation, early warning systems, trust me, at Action Against Hunger, we have, for the emergency team, we have both surveillance and response team. So that's more of internal mechanisms to ensure that in our most of the affected areas, like in Fangak in South Sudan, maybe you've heard the name, we are still able to respond. And we were just having a chat yesterday about how mosquitoes have really infested that area, that during the day you have to have mosquito repellents, you have to ensure that you really protect yourself. Now that's already an impact of climate change. And interestingly, some of these places do not experience rain. You are just seated in your house and you see water coming, passing through your homestead. Interestingly, imagine. So in terms of early warning systems, I know strategies are there. We have clusters that have got emergency components within the structures that government have set, and building dikes, for example, in terms of preparations before the rains, or having people to move, and of course linking up with at country level. Maybe, for example, Kenya, we have the NDMA, the National Drought Management Authority, linking up with the Meteorological Institute or institution, and so they give early warning information to tell that, look, guys, we are bound to expect rains in the next 2 months. And so the early warning system from our government structures, they're already existing. But some of the impacts of this is that rains may be flowing at the northern side, and so people are experiencing floods at the southern side. And already now we have to start working. So you support the northern side to ensure that they have the mitigation processes, but then the water flows directly to the southern side. So it's more of sometimes needs a knee-jerk reaction. But the early warning systems are already in place and they are really functional. Some of these things are beyond, the response team. It's just now a matter of now ensuring that communities really understand and really prepare to ensure that in any eventualities of floods, they can do something. Thank you so much.
Thank you for that. Rhiannon, just on the point that you raised, the whole issue of migration and displaced people globally is becoming front and center. We've seen this, as far as the Americas, and also in Africa, it's something that we've been facing as a constant in the Middle East as well. So maybe just your reflections on that particular issue that you highlighted, and probably just looking at if you have any information around what sort of policy should we be taking into effect. You mentioned the UK stance or this particular position that will be coming to pass soon. Your thoughts?
Yeah, I think that's a really good question, because I think we need to talk about mitigation. We need to push as hard as we can as civil society to minimize the impacts of climate change, but we also need to meaningfully prepare for the impacts that are already unavoidable. And I think in terms of the issue of displacement, I think there are kind of a few things to consider. I think the first thing is kind of trying to avoid that in the first place, right? So providing adequate financing for adaptation. And a lot of that means trying to build more resilient systems and highly centralized just-in-time supply chains, if it's a supply chain, one provider, or if it's a vaccine manufacturer, one manufacturer. Those are not resilient systems. So I think we need to look towards kind of distributed, equitable systems. And in healthcare, that means in the case of being able to get vaccines to people if there's a flood outbreak and you need more vaccines of a particular vaccine, you need distributed manufacturing networks that are kind of in country and can serve the relevant people, rather than one or two manufacturers producing it who then might not want to serve the most vulnerable people in the case of COVID vaccines. And then when we look at health systems more generally, moving away from focusing on highly centralized systems, which require like a lot of power and a lot of tech, but looking towards equitable, distributed and resilient public health systems and primary care systems, kind of as per the Alma Ata Declaration, and stuff like that. So I think that's really important, and of course needs financing to do, and it should not be on the countries who have contributed the least to the climate crisis to provide that financing. And I think when it comes to kind of displacement that we can't avoid, I think that's where John's issue of the human rights approach comes in really, really importantly. And I think with the issue of loss and damage, you can't adapt to being forced to leave your home. You can't adapt to losing your culture. You can't adapt to like parts of your history being wiped out. And I think that's why issues such as loss and damage, which are going to be a really big issue at this COP, are so important, because it is a debt that is owed to people who are inevitably going to suffer as a result of the climate crisis that we've kind of already impacted. And I think when we look at like migration policy and refugee policy, at the moment we have, especially in Europe and the West, we rely on a politics of division for a lot of our different economic policies. And that is where kind of the anti-refugee sentiment comes in the UK a lot. And that's something that we really, really need to tackle kind of like as soon as possible, and ideally before the worst impacts of the climate crisis start arising, and having kind of compassionate human rights-based approaches for migration policies. And I think in particular, we need to kind of move away from the language of any kind of like refugee or migrant crisis. I think that's really toxic, and it implies that somehow these people who are completely unfairly, through no fault of their own, like having to leave a country because of a flood or because of like a war over resources, are some kind of burden. And actually, whereas it's our like duty as an international community to support all people who are forcibly displaced. And I think in Western countries, we are kind of under a delusion that it's like Western countries that are being impacted the most, whereas like the majority of refugees are hosted in low and middle income countries. And how do we look at supporting people, not just in different countries, but also internally displaced people? What kind of policies can we have to support that? I think I'm not going to pretend to be an expert on migration policy, but I think having like really strong human rights, compassionate centered approaches and addressing lots of the really toxic narratives is going to be absolutely essential and a prerequisite to any policies which we implement. And one of those policies needs to be access to healthcare. In the UK, we have a migrant charging system at the moment, and lots of other countries have that as well, including in countries where it's not free at the point of use. So access to healthcare absolutely has to be one of those pillars as well.
Yeah, thank you for that. And you point to a very important point, which I'll bring Dr. Nicole on, is really a question of, you can have the commodity, you can have access to all these things, but if you can't afford it, then it's still unattainable. And so I think as much as we're talking about the supply chain and access, and it does have an impact on just the whole aspect of inequality. So those who have will access, those who don't, who are the majority, will not. And that obviously affects everybody. And I think at the beginning of this call, we talked about that collective action, that we're all in this together. If one country doesn't do this well, and we've seen this with the vaccine, that if we don't actually get everybody vaccinated, then there's a problem. Globally, you cannot be insulated from the problem globally. So I just want to bring in finally Dr. Nicole before I ask for parting shots from each one of you. Just to reflect on what does that look like where you are, Dr. Nicole?
Yeah, it's an incredibly important question. And, as we think about climate change mitigation and adaptation strategies that Rhiannon was mentioned and John was giving such, great examples of this, this urgency that's occurring right now. And, we absolutely cannot forget the interlinkages between public health and climate change. In fact, the thinking of the direct integration of public health provision into national climate change mitigation and adaptation strategies is absolutely paramount in providing equitable access to primary care for all that deserve care. Now, these targeted measures that we think about in building this health and resilience of vulnerable community. For me, coming from an Indigenous community, which is very collective, we are a collective community. And I know in many other places of the world, we are collective as well. You look out for your relatives, for your brothers, your sisters, which is a broad definition. It's not only your brother and sister, it's your neighbor, it's your elder, it's your family, it's your auntie. We've lost that as a society in the West in many cases. And that, in my mind, is what creates that division. We've forgotten about relationship and the relationship to self, the relationship to planet, the relationship to others. And unless we go back to that idea of relationship as the fundamental piece for equitable society, it will be very challenging to ensure care, because when you're thinking about everyone as your relative, you're going to put forward policies that don't create barriers like costs just to be able to access care for your family and for your children. So that human rights element comes back to relationship and how we conceive that as a society. So we have much work to do, Kenneth, but I'm confident, and I have hope. I do have hope that as a global community, unfortunately, through this COVID-19 pandemic, it has become very clear that we cannot do things alone. We need to do things together in relationship. Thank you.
Thank you, Dr. Nicole. So as you prepare for your 1-minute parting shot, I want to welcome Melanie. Melanie, please, if you're on the line, please come on. I know you want to talk about the AFGH, the Global Health Report that you currently have on. Over to you, Melanie.
That's great. Thank you so much, Kenneth. Hi, everybody. Just first of all, just a big thank you to the speakers and to Chair, so Dr. Nicole Redvers, John Otieno and Rhiannon Osborne, and of course, Kenneth Macharia. Thank you so much for joining the session. It's been really interesting. And really enlightening as well. That's brought to life some of the key areas of action of the Global Health Report on climate change and health inequalities, and really helped to demonstrate the need for a series of urgent interventions in order to tackle this triple bind of climate change, COVID and health inequalities. I think all the speakers have shown that without immediate and meaningful action on both COVID and climate change, the health consequences will have disastrous impacts, or continue to have disastrous impacts, on the most marginalised around the world. We've seen through each of the speakers' kind of talks that as we continue our work to tackle climate change, and tackle the COVID crisis, that now is the time to implement these significant changes in the way that we do things in order to create long-lasting and positive change to address these issues simultaneously. Action for Global Health's report demonstrates how the climate crisis is deepening global inequalities, creating a greater barrier to healthcare and exacerbating a range of health issues. The report also provides a set of recommendations which urges a range of interventions across the main carbon-producing sectors, energy, transport, food and agriculture, as well as the need to consider health system strengthening and wider infrastructure strengthening. And just picking up on what Nicole's sort of said a few moments ago, we urge an inclusive approach that ensures meaningful participation of those most affected by the impacts of climate change and COVID at all levels of research and decision making in order to ensure long-lasting and positive action on both the issues and to ensure universal health coverage for all. So just to hand back to Kenneth and to the speakers for their parting shots. But yeah, a final thanks to you all. And if any of you have any further questions, please do reach out to me at Action for Global Health to know any more. But back to you, Kenneth. Thank you.
Thank you, Melanie. Thank you for that. So I will start by asking Rhiannon to give us a parting shot.
Great. Thank you so much, Mel, and thank you, Kenneth, and thank you to the other speakers as well. I think kind of as my parting shot, I would say that as civil society in the G20, we have a huge responsibility to hold people to account on the climate crisis, on COVID, on health inequalities. And I think we have a responsibility to really identify kind of the core causes of problems and speak truth to power, and to not be kind of won over with lovely false solutions, which we know are not going to really address like the real reasons why we're in these crises. And I think it's important that as civil society, we look at how we design systems. Like if we design an economic system to like only incorporate economic growth and profit, and we don't explicitly design in the health of people and the health of planet, it's not surprising that we have a hugely unequal distribution of COVID vaccines. It's not surprising that we're heading towards a climate crisis caused by like completely excessive growth in consumption. So I think as civil society, what we need to be doing as civil society in the G20 is making sure that we use the position of relative privilege and power that comes with being civil society in G20 countries to really speak truth to power and hold people accountable, and to hold our governments accountable, to hold corporations accountable, and to kind of, as other speakers have said, like take that care-based, human rights-based approach to the way that we approach our advocacy as well. So yeah, I think that would be my parting shot.
Thank you for that, Rhiannon. So John?
Yes, thank you, Rhiannon. She's really, of course, I just want to top up what she's mentioned, what she's spoken about, kind of already glass full. So I just want to make it flow. So in terms of some of this, from my own understanding as a nutritionist, and of course now shifting into advocacy, I know we've missed out in some of these discussions, largely on the UN Framework Convention on Climate Change that keep on hosting meetings. Topics on nutrition still remain silent, you know. Food and nutrition security is discussed, but then the burden that it comes with, coupled with climate change, is really, really huge. And so as we conclude this, personally, today we are meeting parliamentarians, and climate change is one of our biggest topics that we are going to discuss. And we've looked at different thematic areas from our programming, from our stakeholder engagement, working with civil society, like the scaling up nutrition, and ensuring that some of these discussions are really mirroring, or rather have a mirror directly to the impacts of climate change. And so these are the issues that we've really flagged out, looking at how we could, talk about influencing maternal and child nutrition issues. How undernutrition is impacting some of these communities, and then looking at how discussions about household food access is the second thematic area that we are looking at, because household food access in the context of humanitarian approach really is one of the key things, because we may not be here to support the communities in the camps or wherever they are, the displaced persons. But then how do we strengthen household economic and of course food access, building climate smart agriculture within those areas, having food demonstration centers and the likes. Then the lastly is on the call to action to our influencers like the parliamentarians, ensuring that budgeting is directly focusing on health systems, but also inclusion of nutrition in the budgeting, so that nutrition is not just a subdomain, but is a main, a big topic that is discussed by parliamentarians. Building and training champions, ensuring that our parliamentarians discuss budgeting for nutrition directly, and that budget is not just a silent budget, but a budget that can be tracked, commitments can be seen, and the outcomes can be experienced. So that is my submission or my parting shot as we conclude. And I'm really passionate about discussing climate change, how its impacts on nutrition, even right now in South Sudan. Thank you so much, Kenneth.
Thank you, John. And I'll pass it over to Nicole, Dr. Nicole, to give her parting shot.
Thank you, Kenneth. Just briefly, because I know we're coming up to the hour here, I want to turn people to the Building Climate Resilient Health System Initiative, which is championed by the WHO and the Adaptation Action Coalition. There's lots of support for carrying out health and climate vulnerability and adaptation assessment. And then finally, I want to remind us why we're talking about this. We're talking about this because we have a mother who was called Earth. She's our Mother Earth, and she is what sustains us. Just like our own mother nourishes us within the womb, we transition out of that womb and we come to the earth, and the earth is there to nourish us. If we do not treat her like our mother, unfortunately, we will not last very long. So just to come back, why it is that we're talking about this, it's the health of us, but it's also the health of our planet as well, keeping that core through our discussions. Thank you, Kenneth, and thanks to all the other speakers today for a wonderful discussion.
Thank you. Thank you. Thank you all for your contributions today and for a really lively debate around this particular issue. There's a lot to be done. And as we've highlighted the fact that we're so interconnected, and at the beginning of this crisis, it became very apparent that we all need each other. And whatever impact that we have or whatever actions that we take in our own home countries has a much bigger impact elsewhere. And so it's important to be cognizant of that. And so we need to speak truth to power, as Rhiannon pointed out. We need to have more resilient systems to be able to take into consideration the context in which we're working in. So the context in the UK, the context in Canada, and the context in South Sudan is totally different. And so we have to have solutions that are also context specific so that they actually have the intended effect in those particular areas. So I think one size doesn't fit all. And I think that's one of the reflections that we have. I think the fact that, there's a lot that's going on, especially on manufacturing, especially on healthcare. I think there's need for us to really think about how do we ensure that that happens and the world has actually enough so that can also be distributed to the people that don't have. I think the whole issue around pricing across the globe in terms of healthcare, and in particular commodities, comes into play. So I think there are a lot of interconnected issues that we all need to reflect on following this particular call. So I want to thank you all for your time today. And I just want to close out. I don't know if there's anything else I need to say, Melanie? No? Okay, I see you nodding your head. So I want to thank everyone who participated on the call. Thank you for joining us today. And I want to wish you a great day after this. Thank you. All right.